wanted to just do a video of me giving Embir her medicine so that you guys could reference it, especially for the inhaler part. I'm just going to give her medicine as I normally do so that you can see it. And the inhaler part is at the end. And it's pretty easy. And she's pretty easy. She's a sweet cat. Try to kind of keep it slow. Give her a little one pill at a time. Here are her pills. They're separated into evening and morning. She has them every 12 hours at 9 a.m. and 9 p.m. And we just find today's Wednesday morning. And there are some small ones in here, and those are important. 2 little guys. Sometimes it's 3 little guys. It's a every other day thing. But she'll have 7 pills or 8 pills in the morning, plus her inhaler. So I will show you how to do this. Put the pills here where I can count on them not rolling away. We have her. She's pretty easy. You just pop her mouth open. She pops her mouth open. And you just drop it right in the back. Hold her chin up a bit. Give her some love. Pretty easy. And sometimes I give her a little bit of a break. Let it go a little slower. Tell her how good she is. And sometimes I also do check to see if the pills are gone, if she has swallowed them. So she's needing a bit of a break here. It's a lot. A lot of pills. There we go. She just opens her mouth pretty easy. If you lift up her lip a little bit, you can grab behind her teeth. And she's super, super nice. She does not bite. She was hand raised from 3 weeks old, so she's very used to being touched, and she's pretty compliant. I didn't think this one ahead. You're probably going to want to use a glass of water or something, because this one's big and I just like to get it kind of wet before I give it to her. I put it in my mouth. You certainly don't have to. If you want to, it's fine. I don't care. But it helps her swallow it to have it not be dry. And if it's too much of a pain, then it's okay that she doesn't have this one. I'll write it down as well. Open it, pop it back there, and she swallows. See? And then to check, I open her mouth, put my finger on her tongue, and just look. Because we don't want to have any of the pills not swallowed all the way and then give her her inhaler. That's happened before, and it was a big foamy mess because she accidentally chewed on one of the pills. We're just going to give her a little bit of a break, and then we're going to do her inhaler. Okay, so this is a baser. And this helps to give a cat a human inhaler. Their face goes in the cup side, and the inhaler goes in this. And I'll show you how to do that. This little device moves back and forth so that you can see the cat breathing. That's kind of how you know you have it suctioned to her. But it's just kind of for you to look at. It doesn't do anything in terms of functionality, so it's not a big deal to pay attention to. What you want to pay attention to is this. inhaler, and this little runaway sometimes will try to get away from you. It's hard to have all these pills and all this medicine, but she's alive, so that's good. So what you want to do with this is, with the inhaler, is you take off the cap first, and then I grab it to where I know I'm not going to drop it, because what we do next is we shake it. I like to have it securely between my fingers and thumb. And so I'm going to shake it for 5 seconds, kind of hard, so that I can hear the inside hitting around back and forth. I don't know how else to describe it. I'm going to shake it vigorously and then insert it into the back here, and you can actually twist it to make sure it's kind of all facing up the same way if you want. I like to do that, it's easier for me. And then the other end goes on her mouth, and then I count to 2 minutes or 120 seconds or however you want to do that, but it's 2 minutes. If she wants to be done a little early, like 20, maybe 30 seconds early, that's okay. I do try to get her to go the full 2 minutes though, when I can, because it is good for her. So, here we go. So we're gonna shake it, 5 seconds. 2, 3, 4, 5. Insert it, get it the way that we like it. Take her gently and cup the cut part over her face. Push the inhaler down to activate the spray. And I count to 120, and I just kind of sit here and I rock her and pet her head, and she likes it. And talk to her a bit. I try to not pet her body too much, or whistle or sing. I've tried that because I thought it would calm her down. It doesn't. It distracts her. Normally, she really loves singing and whistling, especially higher pitched woman's voice. That's a nice calming thing for her, just on an everyday thing, just for you to know. Also, with this inhaler, I'll write this down. But if you drop it, you need to re-prep it, which means you need to shake it and spray it 4 times. And this inhaler is very expensive, so using 4 doses is a lot. Please try not to drop it. I will include instructions for how to reset it if you do. And if you do, it's okay, just try not to. Well, we're getting done here. And she's kind of getting upset because I'm not paying attention to her and I'm still talking. She's doing really good though, huh? But yeah, that's about it. And then after we do this, I give her some treats, and she really likes those blue wellness, the treats that are in the blue wellness package. And I'll write that down too.